So we have here a 59-year-old female patient. She's suffering from severe laryngitis and chronic coughing. And so we found as one of the possible reasons heterotopic gastric mucosa in the proximal esophagus. I can show you the findings. So I pull back slowly and we can nicely see here this large island of heterotopic gastric mucosa on the right hand side and also a smaller island on the left hand side. And we are going to perform an argon plasma coagulation of this heterotopic gastric mucosa to reduce the acid production of the gastric tissue here and hopefully will improve patient symptoms. So therefore we are going to use the novel Erbe FiAPC probe, filter integrated APC probe. Quite easy, we connect here the connector to the APC3 generator together with the Erbe FiO3 generator. So the system automatically recognizes the probe and we can start the procedure immediately. Okay, we are now introducing the probe. It's important that you use only very small strokes, that you prevent kinking of the probe, because now the probe is very flexible. It can be used also in difficult position with the endoscope, retroflex position. Here we can nicely see the ceramic tip of the probe, and we use a transparent hood on top of the endoscope to allow us to get a better angle for the ablation of the target tissue. So we are now going to start the ablation. We'll do that in a longitudinal fashion, starting from one side, going over to the other side. So I start from distal and go to proximal. So this is obviously a clear improvement of the new probe, even though we see all the movements. And due to the movements of the esophagus, we see the target tissue pressing directly onto the tip of the probe. We can see there's no tissue that is sticking to the tip of the probe. So that's a clear improvement here. So because of the patient movement, we cannot keep the entire distance to the stay. Can again start from distal to proximal. And we scratch off the target tissue, so it can nicely be done here. Let's go for one more session to coagulate a little bit the edges, so we can nicely see that we ablated the entire part without any residual gastric mucosa left here.